Risk assessment is a brand new feature in Office Practicum 11. Originally designed for use to meet the meaningful use requirement of smoking status, it has been recast as a broader assessment of the patient's overall risk profile. The tab is characterized with an icon that looks like the no smoking sign and is available from both the chart and while recording the details of both sick and well encounters. Recording is relatively simple. The system brings up a list of risk factors which are both age and gender appropriate. In the case of this 3-year-old, the practice has decided to ask about secondhand smoke, lead exposure, tuberculosis, and the patient's overall oral health. Each answer is constructed from a pull-down, and note that these answers are quite detailed in terms of the medical coding. So if we say, for example, that there is no exposure to smoke at home, that is considered to represent a low degree of risk. And as such, when we click away from the field, note that it turns green to indicate that relatively low exposure. There is also a place to make a note, and while that would not be typical in the case of a situation where there is low risk, let's say, for example, that when it comes to lead exposure, we've determined that this patient lives in a house where there is a risk of current exposure to lead. Note too the other statuses, which include the personal history of elevated blood levels, where blood work has actually been done and come back with a high value, or that the patient in the past was in a situation where they may have been exposed to lead. Each of the answers may also be associated with a diagnostic code. And when that happens, when you generate a problem list item to attach to the risk assessment, that diagnosis code is automatically carried over to the problem. Current exposures, as you might expect, are tagged in red. TB will say that they are not at risk by screening. And finally, for oral health, we'll say the patient in this case is at low risk. Once these answers are recorded, they become a permanent part of the patient's chart. If changed on an intraday basis, they simply change right in place. If changed later on, the log would show all times when different risk factors were altered by users in the course of an encounter. Now I'll switch to a slightly older patient so you can see how the presentation of risk assessment changes based upon the patient's age. You might notice also that as I switched patient, the tab on the right that contains the elements of the summary of the patient's medical condition, the size of the individual subsections on the right-hand side, recalculated how tall each section needed to be in order to show the most available information based upon which areas of the chart are most populated. Now when I go to risk assessment, we see that the smoking status now appears, and the coded values in this case follow the meaningful use requirement. Again, in situations where there is some sort of positive indication, it may be necessary to create a problem list, in which case the system will know exactly which diagnosis code goes with that condition. Note too that one of the elements that had occurred on the younger child's chart is now not available, because beyond this age we no longer make an assessment of the lead risk unless it had already occurred at a previous time. If you do need to go back and include a risk factor which would typically not be associated with this age or gender, you can say show all, in which case the complete list will appear.